Have you ever wondered why some people with diabetes lose weight even without trying? Maybe you or someone you love has dropped pounds unexpectedly despite eating normally or even feeling hungrier than ever. Is this a good sign or something to worry about? Today, we're going to explore exactly how diabetes can cause weight loss, why this happens biologically, which type of diabetes is most often involved, and when it becomes an urgent red flag. This video is packed with science, real-life examples, and the practical guidance you need to protect your health. So grab a comfortable seat and let's uncover the surprising truth about diabetes and unintentional weight loss. Why does diabetes affect weight? Let's start with a simple question. What exactly causes the pounds to fall off? Here's the core idea. White heavy checkmark insulin is a hormone that helps your body use glucose for energy. When insulin isn't working properly or is absent altogether, your cells can't absorb glucose from your blood. Instead of being used as fuel, that glucose builds up in your bloodstream, spills into your urine, gets flushed out of the body. This means your body is literally losing calories through urination. Cells are starved for energy. Your body starts burning fat and muscle to compensate. That's why sudden weight loss is so common in uncontrolled diabetes. Weight loss in type 1 diabetes. This phenomenon is especially common in type 1 diabetes. Here's why. In type 1, the pancreas stops making insulin altogether. Without insulin, glucose cannot enter the cells. The body switches into starvation mode even if you're eating plenty. To survive, it starts breaking down fat and muscle. This process can be rapid and dangerous. Some people lose 10 to 20 pounds in just a few weeks. This is why unexplained weight loss is often one of the first warning signs that leads to a type 1 diabetes diagnosis, especially in children and young adults. Weight loss in type 2 diabetes. Type 2 diabetes usually develops more slowly. In the early stages, the body still makes insulin, but cells become resistant to it. Over time, insulin production can drop. If blood sugars rise high enough, glucose starts spilling into the urine. This can also lead to weight loss, although typically less sudden than in type 1. In some cases, weight loss can occur even as appetite increases. Why weight loss may seem paradoxical. Many people associate diabetes with weight gain. This is partly true. Type 2 diabetes often occurs alongside obesity. Insulin resistance can promote fat storage. But when blood sugars rise above about 180 milligrams per deciliter, the kidneys start flushing glucose out. This constant loss of calories can overwhelm the effects of insulin resistance, leading to weight loss. What other symptoms may accompany weight loss? Unintentional weight loss rarely happens alone. Watch for excessive thirst, polydipsia; frequent urination, polyuria; extreme hunger, polyphagia; fatigue, blurred vision; yeast infections; slow healing wounds. In type 1 diabetes, you might also see nausea, vomiting, abdominal pain, fruity smelling breath, rapid breathing. These can indicate diabetic ketoacidosis, DKA, a medical emergency. When to call a doctor immediately. If you or someone you care for is experiencing rapid, unexplained weight loss, severe fatigue, confusion, vomiting, labored breathing, sweet or fruity breath, seek medical care right away. These are signs your body is breaking down fat too fast, leading to dangerous acid buildup. DKA requires urgent treatment in a hospital. Is weight loss always dangerous? It depends. White heavy checkmark if you are actively losing weight intentionally through diet and exercise, weight loss can be very healthy. White heavy checkmark if you are not trying to lose weight and notice unexplained pounds dropping off, especially with other diabetes symptoms, it's a red flag. Unintentional weight loss is never something to ignore. How is diabetes-related weight loss treated? Treatment focuses on White heavy check mark, restoring insulin function. Type 1 diabetes requires insulin therapy for life. Type 2 diabetes may improve with medication, diet, and exercise. White heavy check mark, rehydration. Fluids and electrolytes replace losses from frequent urination. White heavy check mark, correcting blood sugar levels. Stabilizing glucose helps stop muscle and fat breakdown. Can weight loss be reversed? Yes, once diabetes is treated and blood sugar is controlled, unintentional weight loss typically stops. Your body can start absorbing glucose normally again, rebuilding energy stores. The role of intentional weight loss in type 2 diabetes. This can feel confusing. Unintentional weight loss is a danger sign. Intentional weight loss is often the goal. For people with type 2 diabetes, losing 5 to 10% of body weight intentionally can't improve insulin sensitivity, lower blood sugar, reduce medication needs. The key difference: intentional loss happens gradually with diet and exercise. Unintentional loss is rapid, unexplained, and often accompanied by other symptoms. Action plan: what to do next? Here's what you should do if you suspect diabetes-related weight loss. Step 1. See a doctor promptly. Get blood sugar and A1C tests. Discuss your full symptom history. Step 2. Start treatment immediately. If type 1 diabetes is diagnosed, insulin therapy is non-negotiable. If type 2, your doctor may recommend medications and lifestyle changes. Step 3. Monitor your weight weekly. Keep track of any further changes. Step 4. Eat regular, balanced meals. Focus on protein, healthy fats, and whole grains. Step 5. Stay hydrated. Replace fluids lost from urination. Common myths about diabetes and weight loss. Let's bust a few myths. Myth: losing weight is always good if you have diabetes. Fact: unintentional loss can signal dangerous blood sugar levels. Myth: if you're losing weight, you don't need treatment. Fact: uncontrolled diabetes is a medical emergency. Myth: once you start insulin, you'll always gain weight. Fact: with careful management, weight can stay stable. Conclusion: so, can diabetes cause weight loss? Absolutely. It's one of the most important and sometimes overlooked warning signs that blood sugar is dangerously high. The good news is that early diagnosis and treatment can reverse unintentional weight loss and protect your health. If you or someone you love is experiencing these symptoms, don't wait. Talk to your healthcare provider today. Thank you for watching. If this video helped you understand more about diabetes, please like, subscribe, and share it. Stay informed, stay empowered, and take care of yourself. Because you deserve good health.